And before I get into this, I just want to say that anything I'm about to say is strictly the opinion of myself, and I gathered this from observation and from experience over the last 20 years, but these are some of the things that there's going to be some major changes. Where exactly they go, no one knows, but people need to be prepared for some of the changes that are going to happen in our healthcare system. And with the Supreme Court ruling that was handed down on Obamacare, and then with the president getting reelected, I think that's pretty well set in stone now. I don't think there's going to be, that's going to be taken out, and when it's implemented in 2014 there, we can look for continual changes throughout after that. One of the things that it appears to be a push for, and even the president said that back in 2009, that somebody asked him if this was designed to be a single-payer system. He said yes, and probably would take 12 to 15 years to implement it, but this is going to work toward a single-payer system, and I'll go over a few reasons why I think that'll happen too. It's kind of scary in my mind because our federal government has done such a wonderful job managing Medicare, and our states have done such a wonderful job managing Medicaid, that if we throw in another single-payer system that the government will take over, you know, we're all in trouble. One of the things that just happened recently here, kind of sticking with Medicare, the American Hospital Association and 4 delivery systems within the last 3 weeks have sued the Department of Health and Human Services. That's Medicare, basically. And basically the reason for suing them was for their refusing to pay for hospital care provided to patients, even though all agreed that the care provided was reasonable and medically necessary as the Medicare Act requires. So they did everything properly, but they are not going to pay them because they want to compare apples to bananas. Because the people, and Medicare has gone through and they've been hiring RAC people, recovery audit contractors, like crazy the last 2 or 3 years. And these people are being turned loose on all providers. Everyone will be hit in the next 5 or 6 years. Probably every medical, chiropractic, dental, podiatrist, anybody who is a provider in Medicare will get audited, and basically in most cases they're going to be looking for money back. And one of the things they did in this particular situation, what they're looking at, they said, well, you know, these patients, these group of patients we're looking at shouldn't have been hospitalized. They said the typical protocol would have been say a same-day surgery, and then they were released back at the end of the day out of the hospital. He said, yes, that's true. If that patient's 30 years old and doesn't have any chronic health problems. When a person's 80 and has a lot of chronic health problems, you know, they had to stay in the hospital for 3 days. So they're not following their own guidelines or rules, and knowing some chiropractors that have been through this situation and have taken it to the court system to finally get it overturned, they change the rules on you, and they can do it anytime, any place there. So there's going to be numerous changes taking place there. One of the things that just happened last week, we got our Medicare fees. All providers are going to be cut 27% next year. Now with that, we won't know probably until the end of January whether they're actually going to do that or not, because the last 4 years they were going to cut Medicare fees 20, 22, 25, and 27%, and they didn't do it. And now with, I think, Obamacare pretty well cemented in there, part of the money to pay for that is $750 billion that has to come from Medicare by cutting fees to the providers and cutting waste and fraud, which is fine, but you know, they should have been working on that for the last 40 years too. But I think they'll probably get the money, because if they eventually, when they do cut the fees, if it's going to be this year or next year, it doesn't matter, because the main reason they haven't cut them in the past is all the providers, but especially the medical system, gets hold of their legislators and basically informs them that if you cut us 20 whatever %, we guarantee you within the following year, after we sign up for it, 50% of the MDs will not take Medicare. You cut us another 20%, none of us will take Medicare. And when that happens, if you have Medicare, then the only place you can go is the hospital, and that's filled up with the Medicaid people because none of the doctors will take Medicaid because reimbursement levels are so low. So it'll be filled to the brim with Medicare and Medicaid people, and if anyone else shows up with a heart attack, you're going to die in the parking lot because you won't get through that massive humanity. But hate to be so joyous before the holidays here. But these are just some of the things that are happening right now, and they're going to continue to happen. And there has to be some changes made, but I'm not sure if you know, the government really has to stick their nose in it as deep as they have there. And one of the things too that I see happening is there's going to be a number of medical doctors that will be retiring probably before they wanted to, and primarily for two reasons. Probably at least half or more of the medical doctors are in the system now are probably 50 to 65 years old. And so they're approaching a retirement age, but a lot of them are probably going to retire sooner than what they wanted to, primarily because of two things. Number one, Medicare fee cuts. A lot of groups, because most doctors are in groups now and they're not self-employed, but they're owned by a hospital, an insurance company, or a managed care company. And so they have to follow the guidelines of what these groups want, and if you know they disagree with it enough, and I know talking to some over the last few years and talking to people who work with them quite a bit, there's a number in our area that are seriously looking at retiring within the next couple of years, primarily because of that. And a lot of groups are not taking Medicare patients now. Or if you're 63, 4 years old, they aren't going to take you because you're going to drop into Medicare soon. And then the second thing that's going to push some of the older docs out is the electronic medical health records, which are supposed to be implemented by 2015. And again, talking to them in my age range, that's the last thing you want to be doing the last part of your career there is dealing with that kind of nonsense. But that's going to have to be implemented, or the government comes in and starts penalizing you through their Medicare payments, reimbursements, so much per year. They've got a cap on that, but I think if that doesn't work for them, then they'll just keep raising it where nobody will get any reimbursement from Medicare if you don't have this in place. So that's another reason that I see a number of doctors retiring probably before they want to, because they enjoy what they do, and they're just going to say, the heck with it, I'm out of here. And we don't have enough young students coming up in the medical systems to fill the void, and I don't know if there's enough of the foreign doctors to take their places too. So I foresee that there could very well be a doctor shortage coming up in the future. Plus, the one thing too that usually isn't talked about too much is there's not an 800-pound gorilla over here in the corner, there's a 40,000-pound whale, and that's the baby boomers. And January 1st last year, the first baby boomer dumped into Medicare. And 78 million of us are going to dump into that over the next 18 years. That will bankrupt Medicare, no ifs, ands, or buts. And so that's going to be a major, major problem. And the other thing too is a lot of economists that I've read over the last 15 years have said that whenever our healthcare budget hits $4 trillion, and we're around 3 now, and it's 25% of our gross national product, and we're about 17 now, that the medical system, the whole healthcare system collapses. And that takes the economy down with it. So besides our fiscal cliff that's coming up here shortly, after that, if that gets straightened out, we've got the healthcare situation that's going to have to be addressed and dealt with, because that's something that, for the most part, if it hits those numbers around there, and if it does, that'll be within a decade, probably things will happen that aren't so good in this country there.